All right, so we're talking about, okay, today we're talking about from dealers to healers and our history of healing. I know when I was growing up in Detroit, my mother gave us natural remedies. I remember cod liver oil, castor oil, 3 6s, Father John's, and all those types of things, mercurochrome. Most things we manage, most illnesses common um, and common problems that we had were managed at home. I remember my mother even calling the doctor's office sometime and saying, Jesse has a cold or something, and the doctor and a nurse or so, whoever answered, would share, what's his temperature, what's going on, those types of things. And my mother would, and we always had a thermometer or two. She'd feel our heads, and that was a
Okay.
very
Someone.
common. We need to mute somebody, and that was a very common practice. And so, but fast forward, and I don't even remember taking I took some baby aspirin. I remember at the time, and there were times that if we were really sick, we were on medication. But today, things are a lot different. You have some people are using natural remedies, and that's part of their culture. That's part of their regimen and their choice. But there are significant numbers of people who have been trained to, who have come up with a culture of drugs and medications. So we're not just getting medications from our doctors through prescription. There are a lot of over-the-counter medications. So today we're going to talk about some of those over-the-counter medications, what they're for. Some of them you'll be familiar with, but you probably won't know the problems, the side effects, the negative responses that people get as a result of taking those medications. So we want to make you aware of that and let you know about the natural alternatives, uh, herbs and natural products that are oftentimes just as effective as the drugs, but without the side effects, without the damage that is being caused by the drugs. All right. So we're going from dealers to healers. That's why I call it from dealers to healers. And it's not just drug dealers in terms of crack and cocaine or heroin. It's the drugs. More people are being harmed by over-the-counter medications than by those other substances that we tend to demonize. I'm going to start off with what's probably the number one category: pain relief. So when people have pains, headaches, muscle aches, arthritis, general pain, those types of things, they are normally taking Tylenol, Advil, Motrin, aspirin, or Aleve. Those are some of the most common. And analgesics are amongst the top selling over-the-counter products with over 430 million pack units. Now, this information is actually from 2009, so I'm sure it's significantly higher than that. It could be, it's probably closer to 500 million pack units sold in the United States. But there are some problems with this category of medications. And I have with me today someone who's I would say she's from Detroit, but she now resides in California. She went to school at Wayne State University and went on from there to become a physician assistant, which is on a similar level to a nurse practitioner. She's been seeing patients for a number of years. She's taught at Stanford University. She's really quite educated and passionate about health and wellness. And so she's joining me today. And in fact, her expertise would be in medications and what people can do is alternatives as well. So that's what she's doing in California. And I'm glad to have her here with me today. We've been doing a lot of conversing over over the past several months. And so we have Kendra Patton. Kendra, if you want to share some more about yourself, otherwise we're going to get into this category of medications.
Hi, everyone. So happy to be here. Yes, that's a great overview, Dr. Brown. Thank you for the introduction. I actually live in California. As Dr. mentioned, I'm from Detroit. I'm actually in Detroit now for the holiday, so happy to be home. But in California, I practice Western medicine and urgent care. However, I do also practice online. So I reach people from all over the world with online consultations and things like that. So thank goodness for Zoom and for the internet because I'm able to now connect with people from all over, just like you, Dr. Brown. So it's a pleasure to be here and I'm happy to have this discussion.
All right. So let's jump right into pain relief medication. People are, who are listening or will listen to this are taking these medications, and some of them been taking them for a long time. What are some of the problems that you see with your practice with the patients that you see caused by the pain relievers?
Yes, I'm so happy to have this conversation. I've not yet had a conversation like this in a public forum, and especially with the over the counter medications. We talk a lot about the prescription medications, especially over the past few years, with all of the spotlight being on the opioid epidemic. And
Mm-hmm.
so I love that now we're talking about let's take a step back and talk about the medications that we can buy at any pharmacy. And most likely, we have these medications at home, in our purse, at work. And so I think this is so important that we realize that we don't get something for nothing, meaning that everything that we put into our bodies, including these over the counter medications, have some sort of side effects. And even if you don't feel the side effects right away, your body is having some molecular and chemical change reacting to these medications. So let's just dive in here to talk about Tylenol or acetaminophen, which is the active ingredient. In the United States and Canada, it's called acetaminophen, and then overseas they call it paracetamol. And this medication, everybody takes it, right? I feel like if you're on online, just pop a yes in the chat if you've ever taken Tylenol. That's probably going to be all of us, right?
Yeah.
So with Tylenol, that is one of the leading causes of liver failure in the developed world. So take a second to think about that. This includes some people take Tylenol for intentionally harming themselves, but some people overdose on Tylenol not meaning to. And this is just the regular dosage of taking no more than 4 grams per day for adults. Children take Tylenol, as well as this is probably the number one medication that we recommend for pregnant women to take because it doesn't damage the fetus in most studies. They call it a Schedule A in pregnancy, meaning that it's mostly acceptable for pregnant women. However, a lot of people don't realize that it can cause, even with one dose, it can cause inflammation and damage to your liver. And it is one of the leading causes of acute liver failure when people who take it just as prescribed. So that's something to really think about. And Tylenol or acetaminophen is in some of these other medications as well. So, for example, it's in like your decongestants a lot of times, or it's in some of the cold and flu medications. So, some people don't realize if they're sick, they're taking like the Theraflu, for example, and it's in there, and then they take another dose of Tylenol because they still have a headache, and that puts people at risk for an overdose or really severe liver damage, and people don't realize that that's the Tylenol contributing to that.
Okay. And that was a perfect segue for the next category, which is cold and allergy relief. And particularly during the quote unquote cold and flu season, people are encouraged, supported, and to take things for products for drugs for the common cold, nasal congestion, and allergies, which it seems like, especially here in Michigan, everyone claims to have allergies and seasonal allergies. So we've got antihistamines, we got Claritin, Zyrtec, Allegra, Sudafed, and Delsum. Okay. Oh, as well as Mucinex. See that
Yes,
all the time.
yes,
Now, and at one time, I'm just going to make a short note here. At one time, you had to get the medications from your doctor. Doctor had to write a prescription. And now more things are available over the counter, and the drug companies are marketing directly to the consumer. They're saying, if you have these symptoms, so now people are pretty much self-prescribing. So no doubt the problems are worse. But tell us some of what the problems are when someone says, "Oh, I want to get over the cold quickly," and
yes.
they think just taking some Mucinex or taking Claritin or something is this easy, simple answer.
Yes, I mean, generally for the general population, for this particular category, it's going to be okay. There's a low side effect profile. However, if people have high blood pressure, this is when we need to be careful for just saying take a Sudafed. This can really affect your blood pressure. It can drop it low or it can make it high for some people. And
Mm-hmm.
as some people know, if you've ever taken like Benadryl or Claritin or some of those allergy medications, it can cause you to be really drowsy.
Okay.
This actually some people like that, especially if you're sick or if you right? I mean, I feel like
Yeah.
even
Yeah.
with children, that's like a running joke. Some people may not take it as a joke, but give the
Mm-hmm.
baby some Benadryl if the baby is up, you know.
Mm-hmm.
However, for a certain population, they have the opposite effect. They have a rebound effect, and then they get this extreme energy bouncing off the walls. And this is for this is for adults and children alike. So sometimes it's that opposite effect. So definitely, if you have high blood pressure or low blood pressure, check with your doctor. Should you even be taking these allergy medications? And then the second one is be sure that you know how it affects you before you drive or before you operate heavy machinery, because some people don't
Mm-hmm.
realize like if they have an allergy attack, especially in the fall or in the spring around like allergy time, you
Mm-hmm.
might not even think about it. And then you have to do something really serious that requires a lot of focus and you'll be drowsy or kind of that brain fog. So take it, and this is for all the medications that we're talking about today. It's not that
Mm-hmm.
you should not take it ever, but if you're going to take it, just be cautious and also take it first if you're taking it for the first time before you have to do anything that requires you to drive or be alert. So take it
Okay.
at home in the safety of your home.
So it could cause insomnia,
It can.
anxiety,
Yes,
restlessness, and excitability, but it can also make people drowsy.
right,
So people, it's kind of, it can be, it's paradoxical is
right.
termed. And it can also cause, let's see, they say it can lead to dependency and rebound congestion. So it's like you get rid of the congestion, but then it comes back, and
Yes.
that's a response to the medication, right?
Yes. And
Okay.
those I see that a lot with the nasal sprays in particular, where
Mm-hmm.
people get this dependency on it, where if they don't use the nasal spray, Afrin is the biggest one. So Afrin is over the counter. You don't need a prescription for it.
Okay.
And so a lot of people get immediate relief in their nostrils from nasal congestion, runny nose, etc. You should only use Afrin for 3 days maximum. Some people
Okay.
love it so much that they continue to use it and then they
Yeah.
get this major rebound, congestion, swelling, and it's worse. People will be worse off. So if you're going to use Afrin, only use that for 3 days max. Then people usually will use like a Flonase or something like that.
Mm-hmm.
And Flonase, you're right. It used to be most of these medications we're talking about used to be prescription only.
Yeah.
So Flonase, it works in terms of helping reduce inflammation in the nostrils and the nasal passages. However, it is a steroid. We have to respect steroids. And so I would caution against using that for a whole season. Maybe if you're
Mm-hmm.
having an acute flare of allergies. if you're having
Right.
like really severe symptoms and need to get over your symptoms in the next few days, I say those nasal sprays are fine, like Flonase, or they call it fluticasone if you have a prescription. But
Yeah.
honestly, I would say the best thing you
But
can do is like a
yeah.
saline, like a regular neti pot or a
and
saline
and
type of
we're
rinse.
and we're going to get into that
Yes,
as well.
okay.
I I was I wanted to cover some of them and then talk about the natural solutions as
Okay.
well. I'm glad that you are just a little ahead of me on that. But um, with all these, one, realize they are drugs.
Yeah.
Two, there's a length of usage that's recommended. None of these are recommended that people take forever and always. Okay. Some of them short terms. They are available over the counter. They used to be available by prescription, so your doctor could monitor that. And if you had a prescription, either there was no refills, or it was maybe one or two or three, so they could monitor that. Now there's over the counter. It's anybody can take it however they want to, and they do get abused and used with some other things, and it's causing a lot of health problems. So thanks for covering um, those challenges with the cold and allergy medications. And again, and folks, stay tuned because we are going to be talking about the natural alternatives as well, not just the downside to this. But the third and final category, actually, is digestive aids. And we know, people have digestive problems, constipation, diarrhea, and gas and bloating and all those types of things. So, what are they taking for this? Let's see. I've got calcium carbonate and okay, Tums, Malox, Pepsid, Prilosec, Gas-X, Imodium, Pepto Bismol, and then it's laxatives, Colace, and such. So, what are and I know this big category, a number of drugs. We want to give a brief overview on what people can do in this category, or what the challenges are, what the precautions are with this category of drugs.
Yes. Um, the precautions, I would say in the last few years, there's been some links with some of these digestive medications, particularly with people who have acid reflux. So if you're taking medications for heartburn or acid reflux, ranitidine, I will remember the over-the-counter name in just a moment. I'll look it up, but ranitidine is associated
Mm-hmm.
with cancer, actually with
Mm-hmm.
stomach cancer. So they
Okay.
pulled it from the shelves. I have to look up and remember what the name is over the counter. So I would
Yeah.
precaution
And
people.
yeah. And at one time, X-Lax
Mm,
um was were commonly used, and then they linked an ingredient or something in there that I believe was related to colon cancer.
yes,
Okay.
yes. Okay,
But
so
yeah.
ranitidine, I need to double check. I think it was like Nexium or something like that. It's not even
Mm-hmm.
available. Oh, Zantac. There we go. Zantac.
Zen,
That was
yeah,
it.
yeah, yeah.
So this was recent in
Mm-hmm.
2022. So 2022, they pulled it from the shelves because there was an increased risk. They were seeing people who took this over time
Mm-hmm.
were getting diagnosed with stomach cancer. And
Okay.
so this was a medication that just broadly, I used to work in the emergency department. Anybody came in, we would give them what we call a GI cocktail. That would be part of the cocktail. They would get
Mm,
the Nexium, they would get like even omeprazole and some of these other proton pump inhibitors, which helps to reduce acid.
mm-hmm.
And we would just give it to them like it was water, and so a lot of people take this. I would say these medications are probably one of the most wide or some of the most widely used because a lot of people in developed countries and
Mm-hmm.
societies have stomach issues in general. Digestive issues are is a
Okay.
huge part of our culture,
Mm-hmm.
unfortunately. So these medications, They can cause inflammation and worsening of overall your symptoms. Because if you think about it, if you're reducing the acid in your stomach, you're not going to be able to digest the food in the
Mm-hmm.
way that you need to digest the food. There's a reason that our stomach pH is so low, meaning that it's really strong and powerful. It breaks down the food. So if we're going to counteract that just because people are feeling some symptoms, then
Right.
you have longer term side effects later on. Usually this one doesn't show up for many months or years, but then people
Mm-hmm.
end up having like peptic ulcer disease. You can get ulcers.
Yeah.
You can get an infection called H. pylori,
Yep.
and that is a bacteria that can then it like dives deep into your gut, into the mucous
Mm-hmm.
membranes, and then produces all this acid and causes so many symptoms and problems. So these
Right.
medications just end up masking that. Although people may feel better, you
Mm-hmm.
don't get to the root of what's really causing people's GI symptoms. And I would say
Mm-hmm.
that's the biggest issue with this whole group of medications we're talking about.
Okay. And then we could get into the whole discussion on gut health.
Yes,
And our gut health and our immune system goes hand in hand. And
absolutely.
then if people are taking antibiotics, and we didn't even haven't addressed antibiotics,
That's a
but
whole
then if
master
people are
class in and of
taking,
itself.
yeah, then when people start taking antibiotics, and especially if they start taking them early, then their immune system can be thrown off, and their gut health and digestive health can be thrown off forevermore unless
Yes,
there's some serious intervention. So I'm going to get to
absolutely.
this. If we have time, I've got a couple more categories that we might add in here, but I think we've shared quite a bit. Let's talk about the natural alternatives. What some of the things that people can do in that are beneficial without the side effects and without the problems that these drugs take. So we're going to go category by category. We're going to start with pain relief, that big one. And so for those people following, some of this will be repetition, but hopefully it'll be repetition reinforcement, and it'll be something that you will utilize in your home. Because I talk about the top herbs people need to have in their homes. And um, in every home, you got the medicine cabinet. What do we need to have in there? What what's the drug that may be in there? What's the natural alternative? Number one in my book is going to be turmeric. So for inflammation, uh, turmeric. And there's a couple different ways that you can utilize turmeric. Turmeric is commonly used as a spice in food, and some cultures use it in so many things. Um, if you're using it as a food, if you're adding it as an ingredient, it's not necessarily prescriptive. It can be helpful, but it's not necessarily prescriptive or at a medicinal uh, dose if we were going to categorize it that way. But it's still good to utilize and have, and it may be in the forms of spices and things that we'll get on the shelf. I wouldn't utilize that as a medicine if I had a chronic condition. I mean, I'd add it to food, but recommend that you get I'll say a medicinal quality and level of and type of turmeric. Okay. So again, you can still use it in the food. You can still use it, as flavoring or in different ways. I would say in addition, however, the active ingredient, curcumin, is what we're getting. And for example, a 2016 study found turmeric as effective as ibuprofen for knee osteoarthritis. Okay, so if you can get pain relief for that, then do it. And it's not going to destroy your kidneys, your liver, and all these types of things. So where there are precautionary notes on use, or in these various herbs and natural products, um, I'll share that as well. And if there's something that comes up, of course, for you, Kendra, I encourage you to do that too. So turmeric is one. White willow bark or willow bark is second. Salicin is the active ingredient, is the precursor to aspirin. In fact, that's where aspirin was modeled from or gotten from. Um, and overall, the drugs that are on the market, once upon a time, they had they I want to say pretty much all, at least 80% of the drugs on the market had as their active ingredient or a component of the drug came from nature. And then eventually more and more as they could patent it and tweak it and make it cheaper and but more profitable, or cheaper to manufacture, but more profitable. They go more and more to the drugs and altering it and whatever they do to manipulate that. And that's where we get a lot of negative side effects. When you get something from nature and we're from nature, it's more bioavailable and more and easier to use. So aspirin is a anti white willow bark or willow bark is a has anti-inflammatory effects. It's been used for centuries for headache, joint pain, all types of things. And then we have ginger, reduces muscle pain and soreness. It's anti-inflammatory. And in fact, there was a study. And so everything that I share today as well is going to be backed up by some study. National Institutes of Health, PubMed, something. But there was a 2010 study that showed ginger's effectiveness in reducing exercise-induced muscle pain. So instead of taking, I'm a runner, and I know some people who, before they go on a long run or go on a run, they take an anti-inflammatory, prophylactic, as a precautionary, so to speak. I say, we can take ginger. You can take something else. You can take digestive enzymes. What would you share on that and on the alternatives, since that's part of what you do, Kendra?
Yes, I love this list that you have.
Mhm.
I would share that there's multiple ways to take these the herbs. So as
Okay.
Dr. Brown mentioned, like you mentioned that you could take them in capsule form or you can cook with them.
Hmm.
So find the way that works for you. I like to take all those things you mentioned in the form of a tea. So if you are a runner or if you're an athlete, you can make a tea, you boil the water, you can boil the herbs in there and then drink it before you work out. That's the way that I recommend to take it in terms of the ease of
Hmm.
taking it. But some people like to take it as a tincture or a capsule. And you can find these at most of the health food stores. Um, in terms of like Whole Foods. I don't know what other health food stores are in this particular area, this region of the
Right.
country, but if you
Yeah.
can't find them in your health food stores, you can order them online.
Yeah, some of them are online, and I'm one for getting good quality, good
Right,
sourcing, and not going for the cheapest alternative, because
right,
they've also looked into, done some research and found that some of the products that say they have our natural product have very little of anything in there.
right,
So if you want something that's effective, get it from a good source. It may cost you a bit more. Find the way to take it, the amount to take it that works for you, and use it accordingly.
right.
Yeah.
So the biggest, I would say, probably the most easiest ways to take these is in a capsule or a tincture where you just put a few
Hmm.
drops on your tongue, or you can put it in a, if you're taking a lot of herbs by tincture, you can put them in a
Hmm.
cup and just put all the herbs in one cup, add a little bit of water, and then drink it down like a shot. That's probably the easiest way to do it. So you
Like a
don't have to,
shot. Who
yeah,
drinks shots?
you could just drink it like a shot because what I find is like they're
uh,
sometimes they're diluted with or they're mixed with alcohol or some sort of whatever the
hmm.
carrier is, and it doesn't taste that good. So
Right.
to instead of having to do that over and over with multiple
Hmm.
herbs, just put it
Okay.
in one glass and then you can drink it all at once. So you just get it that takes one time.
Okay.
Um, and then
Yeah.
I would say the other thing for acute pain, I don't know if you still have other things on your list for pain or we were going to move on.
No, I mean you can contribute something else.
Okay.
Hmm.
This may be controversial, but I think that for acute pain, because I know over time, these sometimes work over time where we're talking about the turmeric,
Hmm.
the ginger, etc. For
Hmm.
acute pain, especially on joints or on the muscles, CBD oil or CBD lotion is really
Okay.
effective. And you can get that nowadays in many states easily. I know not every
Hmm.
state sells these types of things because of the regulations and things, but if you're in a state where you
Yeah.
can get this and it's really easy to get, it's really easy to use, and a lot of people have immediate relief of their pain.
Hmm.
And it's very approachable. It's really low side effect profile for most
Right.
people.
And CBD and the CBD products that are available, and some of them are even being shipped from state to state, they they have very it is a product that's derived from cannabis. Cannabis, some people will say marijuana, the proper term is cannabis. But they would have very low levels, less than like 0.1% of THC that would be contained in it. So people aren't getting high from this, but they are getting pain relief. It's effective, and I don't know of any negative side effects from that. I I could toss one other thing in here when it comes to joint pain and some inflammation, and that is castor oil and the castor oil packs. And if you
Yes.
haven't heard my talk on that, it's excellent for this. In fact, for the immune system, digestive system, for the nervous system, even helping people get to sleep, and for the joints, castor oil on flannel wrapped around the affected area. Utilize that with a covered heating pad is tremendous. Okay,
What you just dropped
yeah,
is such ancient knowledge. It was the
yeah,
reason why our grandmothers used to have the castor oil. It's also
yeah,
good for skin and scalp, and it's
yep.
good for women if you have menstrual pain, menstrual cycle cramps. You can put a
Hmm.
castor oil pack right over your womb, and it is very effective for pain.
Chest, abdomen, joints.
Just rub it on your whole body, okay?
There we go. There we go. That's another master. That is a master class.
It really
We
is
may have to do that. So people
because
who listen to this, if you want a class on that, that'll take you a long way. In fact, my daughters use that. I mean, and for children, you rub a little bit of that on their belly if they've got colic or gas
yes.
or a little constipation or something. It does wonders and they respond very quickly. Next category is cold and allergy relief. Top of the list, elderberry. Okay, it boosts the immune function, reduces the severity of cold symptoms. Also good for viruses. 2016 study showed elderberry reduced cold duration in air travelers. So for people who travel, and especially when I'm traveling a lot and haven't gotten rest and you're breathing the recycled air and all that, some people respond. So elderberry is helpful. I know there's another product that's out there that is touted. I would put elderberry above that. Elderberry, vitamin D, vitamin C, very good. Take something before your trip. Make sure you're getting your rest, and that'll be helpful. Nettle is very helpful for reducing allergy symptoms. Anti-inflammatory, it's antihistamine. Peppermint is very good. So just get a good source of peppermint. Sometimes it's taken by mouth droppers. Other times you're breathing it. You can also have peppermint tea. Yeah, you can have those mint teas on a regular basis. Great for digestive health. Besides that, it smells so good, and so allow the aroma to do its good work too. And let's see and then okay, so anything else for okay, and of course you mentioned saline
Yeah.
solutions, one of the simplest things. Eh, for everybody who has salt in their home, you take you have a little bottle, much less if you have a bottle with a dropper. Okay, clean it out if it had some medication or something in it, or something that you don't want to put in your nose. Mix a ratio of the salt to the water. I'd use it with warm water, shake that up and clear it out. Now, sometimes, now, especially because I have a deviated septum, and if I'm going to go on a long run or have a marathon, sometimes I clear my sinus passages before that. That helps some breathing. That's essential during exercise. But if you put those drops in there, not so much that you're crying and you want to pound your fist, but enough to loosen the mucus, similar to what if you go into the ocean or something, or go into the pool, where the mucus flows. Get that mucus out. You'll breathe better. You'll taste better. I mean, your food will taste better, and it'll clear your sinus passages with no negative side effects. Anything
Yes.
else to add, Kendra?
I love the sinus rinse. If you don't want to
Mm-hmm.
make it at home, I'm not sponsored by them or anything, but all my clients, 100% of my clients do nasal rinses, regardless if you have
Okay.
sinus issues or not, because it's a
Mm-hmm.
really effective way to rinse out, to help cleanse your lymphatic system. The
Okay.
glymphatic system. So the lymphatic system
Mm-hmm.
is the sewage system of our body, and
Yep.
the glymphatic system is what cleanses our head, so from the neck up. So this is
Mm-hmm.
why I have people do the sinus rinses. And the brand that I highly recommend because of its ease of use is Neil Med, Neil Med. They have them at most pharmacies, Target, Walmart, those types of things.
Mm-hmm.
And of course, you can get it from Amazon. Highly
Okay.
recommend that. And then I also recommend, so this is for people who have chronic inflammation in their sinuses. There
Mm-hmm.
is a supplement called serapeptase. And this is an enzyme that initially it was for people who have muscle pain. So people who are athletes, and then they recognized that people were also getting clear sinuses from this serapeptase. It's completely natural. It's made from the enzymes of silkworms.
Mm.
And you can get it from all the vitamin stores and online. And they also saw that because it helps to break down scar tissue, women who have fibroids, who are taking this, or if they have blocked tubes. So if they were having struggles with fertility, they would take the serapeptase for like sinuses or other issues, and then their tubes will become unblocked. So if you have any chronic scar tissue like keloid scarring, sinus issues, muscle pain, any type of scar tissues, this helps to break that down as well. It's called serapeptase.
Now, someone asked for the spelling of that. If you can, yeah, share the spelling of
Yes,
serapeptase.
it's okay. Serapeptase. And I'll put it in the chat for those who are live. Serapeptase, serapeptase. There's different dosages. I do recommend to start at a medium dose, which is 120,000 units. You may see like 240 and things like that, but some people, although this has a low side effect profile, some people do get a little nauseous if they take this because they recommend you take it on an empty stomach.
Mm-hmm.
If that happens, just take it with a little food.
Okay, good. So that gets us into the next category would be those digestive issues. So I'll start off with ginger. Ginger. So I'm getting some soon because I've run out. The Oh, you know what? And so what was that? Colds and congestion too. Don't forget your lemon. Don't forget your lemon. Your lemon with. Now we used to have do lemon with honey. People will do lemon with garlic or onion, something along those lines as well. Or the hot toddy, which was a
Right.
whiskey, lemon juice, not for little children. Whiskey, lemon juice, and what else they put in there? There was some, I think there was honey, something in there. If you look it up, you'll see a few different variations. Typically, it contains whiskey. Now, what that does, and there are therapeutic applications for whiskey. Now, for religious reasons or you don't want to relapse or whatever your personal reason, you don't want to use alcohol. I'm not encouraging people to go against those things at all. But what would happen, what I noticed when we were in fact, when we were children, we actually got hot toddies, is that it would heat the body up. And if there was a fever or something going on, we had a hot toddy. My mother would wrap us up. We had flannel pajamas and get bundled up real tight from head to toe. And that fever broke by the, by, if not before the morning. So uh, hot toddies are, possibility as well. There are therapeutic applications for alcohol. Again, that's another class or something for another time. Um, Ginger, digestive issues. Ginger relieves nausea, indigestion, and gas, and is very effective for nausea during pregnancy, motion sickness, and after chemotherapy. There's some applications for CBD and cannabis in there as well. The next is chamomile, soothes indigestion, gas, stomach cramps. It can be used for children. It's very mild. And then it's helps gas. And slippery elm. It forms a protective coating in the stomach. So if people have stomach issues, it reduces irritation. Very quite efficacious, quite effective. Anything to add?
Um,
Digestive issues.
yeah,
Yeah.
so digestive issues, that is my specialty, one of my specialties in helping
Mm-hmm.
people to heal their gut. In addition, those herbs you mentioned are fantastic. In
Mm-hmm.
addition to herbs, I highly recommend that if you have any digestive issues, that you start your day with lemon water,
Mm-hmm.
warm lemon water. Everybody should be doing this. And then the first 6 hours of your day or so, eat fruit. Fruit is so powerful in helping you to cleanse out your digestive system, your colon, your small intestine, and it's really anti-inflammatory. So that's what we're talking about here in terms of digestion, how to reduce inflammation in your gut. And that is by reducing the processed foods, the bread, rice, pasta, things like that. And especially if you're having an acute digestive issue, to really honor your body and try not to intake so much food. And what I usually tell people is if you can do a bit of a fast, if you
Mm-hmm.
can, and just drink tea and things like that to help give your body a break, that's great. But if not, if you, for whatever reason, have to eat, some people need to eat due to certain medical conditions or medications that they're on, then keep it light with fruit. That is a really powerful way to honor your body.
Okay. And here's something that I do, and this helps elimination. I learned this from a naturopath a long time ago, and that is to drink water, room temperature water first thing. Now, when I do that, within 15 minutes, I'm going headed to the toilet. Okay. So, so some people want to drink the water, drink the plain water first, cleanse out, and then do the lemon water. And fasting is an option as well. And when we say fast, we're not saying don't eat anything. I mean, there are various forms of fast out there, so that means different things to different people. But it's not eating for a certain period of time. It can be during for a period of time during the day, 1 24-hour period, or it can be for a certain number of days, or we're fasting only utilizing juices or some variation besides the standard 3 meals a day, every day, and a dessert. And because people are typically overeating the wrong things, and the body can't heal and repair when it's fasting. And again, uh, disclaimer here: if you're on medication, you're diabetic or something, and you have to eat, we're not saying don't do what your doctor says or what your typical protocol would be. This is generally for healthy people who are having digestive problems or something. Okay.
Mm,
The let's see. So the we can go into, I think we got a little bit more time to go into conditions and then sleep aids.
okay,
Now, uh, I think it's normally the women who are really concerned about their skin.
that's right.
It's kind of funny because I don't have a strong skin protocol, but I think that every woman that I know does have a skincare, protocol. So what are some of the common skin conditions, cuts, burns, acne, breakouts, or various things? Some of the things that are okay. So some of the things that are used
Mhm.
here are
I
yeah,
can take
you want to share?
Yeah, I can
Yes.
take so in terms of over the counter things,
Hmm.
for common issues of the skin, that would be the common issues that I see a lot would be eczema, or what we
Hmm.
call atopic dermatitis, and that can be eczema on the skin or the scalp. So some
Okay.
people get like chronic dandruff, acne. Also, if you have psoriasis, psoriasis is less common, but it can be pretty severe, or it can affect people's emotional state. And I would say across the board in terms of
Hmm.
dermatology, it has a big mental health component to it because it is something that our skin is trying to tell us, hey, we need to fix these things internally, and then it manifests externally.
Hmm.
So, some of the over the counter things that I see a lot would be like the retinols. So, the retinols, they used to be prescription, but now they are over the counter. Different gel, for example. Different gel is a retinol. Also, the over the counter things would be um, even the lotions like CeraVe, Cetaphil, those
Hmm.
typically are pretty good in terms of cleansing. This is a multi-billion dollar industry over the counter. I
Hmm.
would suggest that people, if you have any skin issues, you talk to your doctor about it and you mix that with some sort of natural protocol. Because one thing that a lot of the doctors, PAs, people in Western medicine, they will prescribe steroids really quickly, or they
Hmm.
recommend it. So if we're talking about over the counter, like for example, cortisone or hydrocortisone, that's
Yep.
an over the counter cream that you can use for bug bites, even eczema. However, chronic use of that, and when I say chronic, I just mean over 2 weeks, can cause your skin to start thinning. And it also can cause you to have scarring in the long
Mm.
run. So you do want to make sure that if you're going to use any of these over the counter medications, you recognize how long you should be using them before you put it on your routine forever.
Okay. Lotrimin,
Lotrimin,
antifungal.
yeah,
Yeah.
so Lotrimin is usually used for like athlete's feet, or if people have skin issues like the fungal skin issues. This is very common when people have diabetes or blood sugar issues, that they can get rashes in
Hmm.
the wet, moist areas of your body. Sometimes we see it as a yeast infection, but sometimes we can also see it under skin folds. And they have Lotrimin and other antifungal medications. Those I would say are relatively safe, but make sure you know that it's a fungal infection before you go putting this medication on. So this would be something that you talk to your doctor about. And a lot of times they have the equivalent, either a prescription or you can use this Lotrimin over the counter.
Okay. So you say make sure that it's a fungal infection and, for example, not a bacterial infection because they're handled differently, right?
Exactly.
Okay.
Exactly.
And here's something, if it is fungal, perhaps even if it's bacterial, this is uh, one of my top go-tos. Okay. I should probably have stock in this company if they have stock, but oil of oregano. Oh
Yes.
my goodness. Here, I went on a trip. I went on a ski vacation, and there was a buddy of mine. He was asking me, like, what are you taking? And it's like, okay, the plane ride, this was out of the country, and the plane ride and everything, I was feeling a little scratchy throat or something. I took some oil of oregano. I said, I'm all the way over here. I'm not going to a doctor. I'm not. I don't want to get a cold. I don't want to be sick on my vacation. I took this and it warded off, anything getting worse. And I gave him some. He said, "Can I have some of that?" I gave it to him. He later reported, he said, "Yeah, I didn't get a cold either." He said, "And you know what else?" He said, "My athlete's foot or athlete's feet condition went away."
Yes.
Okay. So, many times people don't realize and they think it's common to just use the powder. They're using some things routinely. They've gotten accustomed to it, not realizing it's an imbalance somewhere.
Right.
So we've talked about digestive concerns and all these things. So when you're taking antibiotics, when you're taking drugs, one of the overarching theme here is if you choose to take medications, there are side effects and they can affect, of the categories and things that we mentioned here, a number of different systems of the body. They'll throw, one thing it'll correct, but it throws another system or something off. It could be for a very long time. What we want to encourage people to do whenever possible is to go back to nature. Look to your food, look to your lifestyle, look to something that's not going to damage your kidneys, your liver, and cause all types of problems, or something they're going to end up taking off the market a decade or so down the road. And you realize, oh, I've got cancer because I took this medication some years ago. There are a number of deaths that are attributed to taking prescription medicines, even properly prescribed. I believe it's the third leading cause of deaths is prescriptions. So you want to be the healer in your home, you're healing your family, you want to help yourself in different ways. Find out. Let's reclaim our traditional forms of healing, utilize it for ourselves. It's good for solving the problem for people. It's good for the planet. It's good for our offspring, for generations to come. Right. So we're going to be, wrapping up here. Um, and basically, if there are any questions in the chat, I think we got the spellings, we got the information out there. I don't know if we're still live streaming, but I want to thank those of you who are on the call on Zoom or Facebook Live, and thank Kendra Patton for being on this call as well. Again, she's Detroit homegirl, and now she's in Cali, but we'll still allow her to come from time to time.
I'm here. I'm in Detroit right now, so I'm always a Detroit girl, but
All
yes.
right. All right. Detroit in the heart. Okay.
Yes.
And we would thank all of you for that are going to see this, and encourage you to share this with your friends, your family, your community, and to keep on watching and looking for more episodes, more calls like this, where we'll be addressing how you can take care of yourself, how you can be a benefit to so many, and how we can go from being dealers, inadvertent, unwitting, sometimes unwilling um, drug dealers, to becoming healers, because we need more healers. Just imagine if we had 1 million more healers out here doing good work, helping people to avoid a lot of the problems, and to bring up their children, the next generations, in ways that are healthy, will make us all so wealthy and wiser. All right. So take care. Be well until next time. Dr. Brown signing off with Kendra Patton and my crew in the background helping as well. And see you.